Joyce, what are some of the exciting things happening at Seven Rivers that the public may not be aware of if they haven't been a patient here?
Well, one of the exciting things is that Seven Rivers Regional Medical Center was awarded the top 5% in the nation recognition from Healthgrades for orthopedic services. Specifically, Healthgrades, which is a national organization that looks at your quality outcomes and your outcomes related to low complication rates for a procedure, and they will look at that national data and then rank that nationally, and then actually communicate to the hospital to say your quality outcomes in the provision of that care by your surgeons and by your therapy staff and your nurses that take care of that patient has resulted in what they call a 5-star rating, high quality and very low complication rate. So in 2014, Seven Rivers Regional Medical Center actually earned this high 5-star rating and I got my notes, so let me just say, in the following procedures: Joint Replacement Excellence Award, Spine Surgery Excellence Award, top 5% in the nation for overall orthopedic services, ranked top 10% in the nation for joint replacement surgery, 10% in the nation for spine surgery, 5-star rating for total knee and hip replacement, and that's actually 8 years in a row. 5-star rating in hip fracture and 5-star rating for spinal fusion. Now last year, Florida Blue Cross Blue
Yes.
Shield actually awarded the hospital what they call their Blue Distinction Center Plus for hip and knee replacement surgery for the same type of review. Very high quality outcomes, very low complication rates. So my nursing cap off to our orthopedic surgeons on staff here at the hospital, Dr. Petrella, Dr. Tumbas, Dr. Keene, Dr. Chung, for the care that they give our patients and for the expertise of our nursing staff and our therapy staff that are here, because it's a team effort. Everyone contributes to the care that that patient receives. It starts at pre-op, then the operating room for all of the OR nurses and surgical techs in the OR, the nurses on the floor that takes care of that patient, the therapists that provide care, the discharge planners that make sure that the patient and family has everything they need when they get home, and then the aftercare. So that's what's going on at Seven Rivers Regional Medical Center.
Wow. So how does Seven Rivers operate in relation to the community? I mean, I know or you have board of directors and probably some other stakeholders, possibly patient input. What kind of guides Seven Rivers?
Well, we do have a local community governing board, and there are individuals on our governing board who are local community lay members, business leaders in the community. Also, there are physicians on our governing board as well, physicians who work at the facility but also hold leadership roles within the medical staff. So you're going to have your chief of staff, for example, of your medical staff, as well as other physicians on the governing board that shares input and insight as you discuss your credentialing of practitioners to the medical staff, that you review your quality and patient care data as you develop your strategic plan, and you ensure that you're meeting your mission, and that is providing excellence in care to the community.
Okay, everybody knows something about Seven Rivers, but what are some of the other services in your system, like clinics, labs, physician services that people may not be aware of? Other locations, too, they may not be aware of.
Sure, Pat. We operate Seven Rivers Wound Care Center, which is operated in Crystal River next to the Sweet Bay Center downtown. And at the Seven Rivers Wound Care Center, there are hyperbaric oxygen chambers that patients can receive that level of complex wound care if necessary, as well as we have surgeons who provide care at the wound care center that help to address wounds that may have difficulty in healing and need some complex care, be it hyperbaric or be it some specialty dressings. So wound care is one. Second, we also have an outpatient rehab center where we provide physical therapy, occupational therapy to our patients. That's actually located next to the hospital in the Seven Rivers Professional Center, right next door to the hospital. Last year, we actually started our Seven Rivers Cardiac Rehabilitation Center for those patients who had some type of coronary intervention, like a placement of a stent after a heart attack, that they could actually have a few weeks of cardiac rehabilitation using exercise equipment and cardiac monitoring with an RN and a physician to oversee that care, so that they can truly feel like they can recover after that coronary event and begin to learn more of how to manage that chronic disease now. We also have off-site in Denellen a imaging center, Denellen Diagnostic Center. We've had that center for a number of years, located on Williams Street, that provides outpatient imaging, lab draws, as well as digital mammography. So either at our outpatient center, at Denellen Diagnostic Center, or at the hospital, the level of imaging for mammography, both centers are digital, so we can ensure that we're giving the highest level of care to the ladies that have their mammography services done at either location.
Okay, what is some of the medical technology available for treatment that some people may not be aware of? Some of the newer things, perhaps?
Well, one of the newest things that we've seen over the last couple years is moving to more and more minimally invasive surgical techniques. And what I mean by that is where the surgeon can actually do a very small incision, just a few inches in length, and use a laparoscope or videoscope of sorts and conduct the surgery through a single site. Now, here at Seven Rivers Regional Medical Center, we do have the Da Vinci intuitive robotic system if our surgeons wish to use that. We also, though, have laparoscopic single site instrumentation for our surgeons, where a number of procedures can be done with just a very small incision and viewed using video equipment, where the image is transferred onto a very large digital computer screen, and the surgeon and team can actually see what's going on during the case besides just the surgeon, and assist the surgeon accordingly. So where I'm going is surgery is becoming much less invasive for the patient. And it's not just about having a small scar, it's about having to do the least amount of movement internally when you do a surgical case, and that helps with the actual recovery of for the patient.
Okay. How much of it is a challenge now to have to deal with the shifting health landscape regarding the various government programs such as Medicare, Medicaid, the new one, as Obamacare, as they all call it, and even private insurance?
Well, I think first and foremost is right now our community has the opportunity to use an online marketplace, the website for Obamacare, to actually determine, is that an option for an individual in our community. And if someone in our community does not currently have health insurance of some kind, be it Medicare, be it Medicaid, or they're employed and their employer does provide that benefit for them, this at least now gives that resource to someone to see, is this an option for you? Or are they going to be faced with the penalty when they file their taxes, right, for not having health insurance? So the one thing we have done is provided some training to a few of our folks here. So if a patient is here and that's something that they would like to understand more, we can at least provide a little bit of information about that website and to them to try to help them. This is new for everyone, and learning those changes as we all travel, together in the changing landscape of health reform is something we're going to do together.
Okay. And what are some of the biggest challenges facing Seven Rivers?
Challenges are also, opportunities, and there's two that is related to federal law changes as well, and one is what's called computerized physician order entry, where because of the high-tech law that was passed a few years ago and related to the Affordable Care Act as well, all hospitals have to become fully electronic in their documentation. So physicians have to begin ordering tests, medications for patients via a computer. It's required by law. When I was trained, everything was done with pen and paper, and now the federal law says no, it has to be done via a keyboard. So our physicians and our staff are learning what is the best way to do that, what's the best tool that we can give our physicians to help them do that when they're rounding on a patient. So I think in the future you'll be seeing more laptops and iPads and tools like that physicians will be using to actually place orders for patients. Even orders as simply as diet meals will be electronic and be ordered via a handheld device. So that is one change in the healthcare reform that we're implementing here moving forward. The other is the fact that in the nation, the actual coding of the record for billing purposes is totally changing in the United States. Prior to this year, medical records were coded for payment under a system that's called ICD-9. We are now required to code under a upgraded version of that system called ICD-10, and it really does take the number of diagnoses that you had before and exponentially increase them. So that is a learning curve that now our staff, physicians, nurses, coders, administrators, everyone has to learn, because it is also based on the fact that now you basically have to learn a new language of what do you have to document in that medical record so that we can code it consistent with what these new guidelines are.
Okay, and this is kind of getting more on to you as an individual. What are some of the community organizations that you involved with outside of the hospital?
I currently am the chairperson of the Nature Coast EMS board and have been actively involved in that board for over 10 years. I also am a director on the Citrus County Chamber of Commerce board and have been since I think 2008 on that board. And then last year was appointed by our governor to serve on the district board of trustees for the College of Central Florida.
You need a few more things to do. So, and again, outside of your job, what are some of the activities you enjoy in the little amount of spare time you have?
Well, my biggest activity that I enjoy is just being a wife and a mother. Very proud of the accomplishment that I'm seeing at home with my daughter as she progresses at Crystal River High School as part of the Health Academy program there, and just earned her CNA license.
Wow.
Yes, as a junior. That's right. It's an outstanding program that's in Crystal River High School, so if I can give applause to our school system in Citrus County for having those types of academies at the high school level, where our high school students can actually earn an actual license that prepares them for a career when they come out of high school, particularly as one in healthcare, where they can immediately be hired on completing that type of training and earning that type of credentials, and be just way ahead of the game when it comes to going to college and having a career.
And I always ask, is there anything else, anything to add, anything I omitted, or something you think we need to be said?
Let me close by just saying that I view it a privilege to lead Seven Rivers Regional Medical Center. Every day I am awestruck by the compassion and the care that I see delivered by our physicians and by our staff and our volunteers that come here every day to provide care and concern to not only the patients but the family members that are here. So I feel very privileged that I have this opportunity to lead Seven Rivers Regional Medical Center.
Okay, Joyce. I really